welcome you all on behalf of Center for Youth and India Water Partnership for the fourth webinar series on water smart solution. And as I've been sharing in the last three webinars also, the whole purpose is giving the fellows an overview and understanding on the kind of water challenges that are there in the audio. Hello.
Hello, Alka.
I thought my audio is locked. I'm really sorry.
Alka, your audio is very less.
Achha, my audio is very less. I'll start again. Okay.
Yeah. Volume wise, it is not audible.
No. I think it is fine. I can listen you properly, Alka ji.
Yeah, I can also. I think maybe.
Great. Yeah, so
Yeah,
Vinaji, you check it out at your end. So, okay. So, thank you very much, everybody, for joining.
I can't hear you properly.
Vinaji, check it out, your audio of your computer. Vinay, check out your audio.
No, I think that the call was coming. Probably that was the reason.
Maybe that's the reason. Okay. Let me start my introduction again. Okay, so I welcome you all, and with not much formalities that I'm going to do, and especially I like to welcome today Mr. Aanand Kumar. He's head of programs for WaterAid, and Shalini Chaturvedi. She's the program coordinator of WaterAid. And today, WaterAid has kindly consented and to share their experiences on the water sector, how they have been working in addressing the challenges of accessibility and availability of the safe drinking water at the community level. I'm not summarizing WaterAid experience in one line. It's much more and beyond. In fact, when we were having discussion, I was told by both of them that if they have to really share experiences in the work that WaterAid has done, it'll take almost a day or a week. So they have a very tough challenge to consolidate everything in an hour. But the most important part is the fellow gets a feel of the kind of solution strategies that are there that has been practically tested on ground. And so these are time tested solutions, and we want that insight for our fellows. Thank you very much, both of you, for joining. And let me also introduce this expert for today. So Aanand comes from, he has experience of 18 years in the development sector. And when we say 18 years, I'm sure it will be a journey of its own to share. And he has worked with range of international organizations, CARE, Aga Khan. Can somebody mute their mics? Aga Khan, CARE, India and all that, and plus with CSR ITC Limited, with the National Dairy Development Board. And he holds a Master in Rural Development from IRMA. In fact, I have also studied for one course in Gujarat in Ahmedabad and traveled to IRMA also. And he has done a post-Harvard trainer from International Rice Research Institute, Philippines. So this is the kind of background experience that is bringing to fore today for us. With Shalini, she has 15 years of experience in the sector, and national level she works with range of organization. I think the most important part for her is the decentralization and governance aspect, and plus she is from SISS from Ranchi, from Ministry of Rural Development, and Master of Rural Development, and the diploma on decentralization from gender perspective. She's from International Center for Local Democracy from Sweden. She has done the course, and so both of them has accomplished a range of experience that they have done, and has a range of experiences and accomplishment to their credit. So with these words, yes, I request both the speakers to take the forum and move forward with their presentation.
Thank you, Alka. What I'll do is I'll just put my presentation and then we can probably have a chat on that.
Yeah.
Just give me a second.
Yeah, and can we have all the fellows, if they can later maybe switch on their camera so that we can have pictures also for the webinar. Maybe once you finish the presentation, then we can have the cameras on. And
Alka, can you just raise your volume because it's not very laudable.
okay, everybody, am I audible to you all, or is the same scenario people are facing?
Ma'am, you're audible.
I'm audible?
Yes, ma'am.
बहुत कम आवाज आ रही है अलका.
Veena ji, आपके end पे we have to see because the audio is correct here.
हमारा तो ऑडियो सही है यहाँ पर.
And all the speakers also, the speaker and fellows are saying this, their audio is also okay. My audio there is okay. So I'm reaching out to them loud and clear. Maybe you can log in from another device. Yeah. Yeah, Aanand?
Yeah, so let us, what I'll do is I'll just keep on the side because I am more comfortable this way, if that helps. So good evening to all of you, and thankful for this opportunity to share with people the work that we're doing, especially young impressionable minds. I'll just be talking about a few, about WaterAid, the work that we're doing, the sort of work that we want to do, and so WaterAid is a very niche organization, if I can start that way. It works on water, sanitation, and hygiene. The genesis of WaterAid has been that it was established in the UK in the decade of 80 to 90, which was on sanitation and wash. It was established by water utilities. So generally, organization established by a foundation, or you have a business entity, or comes as a social organization. WaterAid does not have that sort of a background. It was established by water utilities. So if you give an example, by the Thames Water Board, something like the Delhi Jal Board that you have, they all came together and they thought that we probably can expand on the sort of experience that we have and impact the world with the sort of experience that we have collected over decades of working to serve on wash needs. And therefore, they came together. This was established in UK. And even if you go today, you'll still find that water bills in UK have a small write-up in the end, and people can contribute either £2 or £5 or whatever they want. So that was the start of the movement in that sense. Then WaterAid expanded across the world. So we have offices in Sweden, we have in Canada, we have in Japan, other locations, and then we work across India, Pakistan, Nepal, Bangladesh, quite a few countries in Africa. That's the way that we are structured. So I'll just take you through the initial introduction, and then we'll talk about a bit more detail about concerns or issues that we are facing in that sense in India. So I'll just take, and then Shalini can join me as we go ahead. So we are basically in India. We have a head office in Delhi, and then we have. Sorry, I'll just mute my. So we have offices, regional offices in 4 locations: Bhubaneswar, Bhopal, Hyderabad, and Lucknow, which are manned by regional managers. And then there are teams around there, and we work directly with corporates, India and international, with the governments very closely, and we try to impact and influence and also innovate in water, sanitation, and hygiene across the work that we're trying to do. I'll go ahead in this screen. I'll just explain this. This is about students, especially in institutions like schools and Anganwadis, handling or getting water enough to remain clean and to ensure that they have a fulfilling childhood in that sense. So going ahead about WaterAid, it is an international not-for-profit organization, and determined and interested to make clean water, decent toilets, and hygiene available and normal for everyone everywhere. For us who are more fortunate, this looks like a given and as a basic necessity. But believe me, across the world, and that's data we will be sharing as we go ahead, you'll find that this is not so. If you step out of your homes and you look around in the slums, you'll see the difference that it is there as compared to the way that we have been living. The vision that we have been in India since 1986. The vision that we have is a world where everyone everywhere has safe water, sanitation, and hygiene. And the mission is to transform the lives of the poorest and the most marginalized people by improving access to safe water, sanitation, and hygiene. Where do we work? We have a presence in core states. So these are states where we will continue to have a presence for the next 5 years in pockets of about 10 gram panchayats each in Bihar, in UP, in Madhya Pradesh, in Chhattisgarh, in Odisha, and in Andhra Pradesh. We also work in states that we have called strategic, which are Rajasthan, Jharkhand, West Bengal, Maharashtra, and Telangana. These are states where we will work if we get a project or it is possible that we can work with the government. We also work in cities. So 2 cities where we will definitely have a presence is Delhi and Hyderabad. And then we also get work across different locations depending on donor priorities and our own abilities to work and ensure that wash becomes a fact of their lives. What work we do? We work on drinking water, and drinking water we'll be talking about in detail as we go ahead. And we will also be taking your inputs and your impressions once this comes in. The second thing that we work on, sorry, I think this slide is washing institutions. Institutions for us means schools, government schools in rural locations, Anganwadis, which are sort of stepping up places where small children get nutrition and some amount of preschool understanding. And then we also work in primary health care centers where availability of wash facilities is required, but in a lot of locations that is not available. We work on sanitation, and we are working and supporting the Swachh Bharat mission with the government for quite some time now, and also in the Jal Jeevan mission that is now starting up. And we work on hygiene education, messaging, menstrual hygiene management, and other aspects that are around it. It is not only about the work that we do, it's also the supply chains within these sort of work that we try to impact and influence and ensure that the poorest and the most marginalized have access to these as they go ahead in their lives, so that they have better lives and livelihoods and can ensure the same in impoverished conditions to their communities, their families, and to themselves. What is our approach? Technical support, influencing government for change and scale. We'll explain all of these as we go ahead in examples. Test bed for innovation. We try to bring out innovations, and we try to ensure leadership of women and youth as we go ahead. I'll just, so these are key supporters, donors and funders who have supported our work and as we go ahead in India and elsewhere. And then we'll talk about the water crisis. But before we do this, I think it'll be good from here that Shalini leads and I'll be supporting her. But even before Shalini leads, we'd like to really have an introduction from all of you. So if you can just talk about what your name is and what you are interested in. If it is in wash, it'll be better. But otherwise, also we are more than happy to understand and to get an introduction to you, all the the fellows who are here. So if you can go one by one and talk about it, I think it'll be helpful and encouraging us as we go ahead and talk about this. Just your name and your interest.
I think Alka ji, you were saying something, but you were on mute.
Shalini, yeah, you can actually tell them and ask them to start by name, or they can be spontaneous.
Yeah, spontaneous. I mean, but one after the other. Yeah, spontaneous. Yeah.
Yeah, I think Veena ji has raised hand. Veena ji.
Hello. Yes.
Yeah.
Hello. Can you hear me?
Yes, Veena ji, we can hear you.
Good afternoon, everyone. And thanks to Shalini and the other person, I just forgot the name. Very good afternoon, and good afternoon to all the fellows who are with us. My name is Veena Khanduri, and I'm the country coordinator of India Water Partnership. And we are hosting this program with C4Y for the second cohort. And I'm very privileged to have WaterAid with us, because WaterAid is our network partner organization also. And we know Madhavan from so long because of our association in the water sector, as well as very proximity when he was working in Chirag and other institutions. So we would be happy to have your experiences in the wash and sanitation sector. I'm aware of the all programs, but it is good to again know from you, both of you today. So thank you so much.
Thank you, Veena-ji. Thank you for putting that in place. Okay. Yeah, we can start with the introduction. Yeah, Abhishek.
Hello.
Yeah, please, Abhishek, go ahead.
Good afternoon, all. This is Abhishek, and I'm right now currently working with CSC. And if I'll talk about my interest, then I'll go for water plus women's security in India.
Okay, thank you. Yeah, Ajay. Women issues. Ajay, you can.
Yes, ma'am. Good evening, everyone. My name is Ajay, and I'm currently working with WaterAid India. And I'm mostly interested in how the communities can be involved and empowered for providing sustainable water access, and the community especially which are living in far away areas from urban centers. Thank you.
Yeah, sure. And yeah, Amrita.
Yes. Am I audible, ma'am?
Yeah, Amrita.
Okay. So good evening, everyone. So my name is Amrita Singh, and I am pursuing my master's from Department of Environmental Studies, Delhi University. And currently, I'm working with JS Water Energy Life Co-Private Limited. And my areas of interest, there are two areas that I would want to work on. So first is the water treatment technology. For example, bioremediation or phycoremediation and so on. And the second interest of mine is the water security and climate change. Thank you.
Great, great. Anubhav?
Good evening, all. My name is Anubhav, and currently I am an intern with WaterAid India. And I would like to work in groundwater management and the how groundwater table can be uplifted in this sector currently, and with water security, I would like to work. Thank you.
Okay, great. Okay, Lipi?
Good evening, everyone. I am Lipi Gandhi. I'm currently pursuing my master's from Terry School of Advanced Studies in Water Science and Governance. I'm currently working with CEEW, and my topic of interests include groundwater hydrology and management and urban water management.
Great. Okay, Niharika?
Good afternoon, everyone. I'm Niharika Lapsitwar, and I'm currently pursuing my MTech from TD School of Advanced Studies. And my interest is in urban water management and use of innovative solutions in water management.
Yeah, thank you. Yeah, Niharika? Then another one, Niharika? Okay, Niharika Kaushik is writing. You can't. She's working with CSC and interest is in river rejuvenation. So Niharika, your audio is not working. Yeah. Okay, Preeti, can you please go ahead? Preeti Vasudevan? Yeah. Yeah, Preeti. Okay, till the time Preeti comes back, Siami Bhardwaj.
Hello, good evening, everyone. I'm currently working with CSE, Center for Science and Environment. My interest is in sanitation in the urban areas, basically mapping how excreta flows and it is managed within the city. Thank you.
Thank you. Shweta?
Good evening, everyone. I'm placed with WaterAid India itself, and my area of interest in water sector lies with the rainwater harvesting techniques and groundwater recharging systems. Thank you.
Thank you. Upma?
Good evening, everyone. I am Upma Garg. I am studying in MSc Environmental Studies in Delhi University, and I am placed with CSE. My areas of interest are water security in current scenario, understanding behavioral responses, and awareness generation among the masses, and also the following of zero waste management lines. Thank you.
Yeah, thank you. So Preeti, we're coming back to you again if you're around. Yeah, I think Preeti, maybe whatever reason, yes. Shalini, back to you now.
Okay, thank you, Alkaji, and good evening, everyone. And nice to hear your brief introduction and your interest area. And it's really nice to hear that means all of you are, since the internship itself is around water, so everyone has an interest area in water security, climate change, and but I see a very specific interest around urban. Many of you mentioned around water security issues and groundwater in context of urban. So that's a good thing to know. So today, like as we move forward in this presentation, we'll be talking about general like a context around water crisis in India and how acute it is. We have been hearing in news like every time there is, especially in the summer seasons, we hear a lot of stories coming from rural parts, urban parts, like how the people are suffering with the water issues, tanker supplies related issues, and how like for a week people don't get water, and if they do get, it is not adequate enough to meet their entire needs, which includes drinking water, cooking, bathing, cleaning, everything. We when we talk of water, we do take drinking water as a special emphasis, but it water use also includes other aspects. So in context setting, we'll be talking around that, and then we will have a very focused discussion around groundwater issues and how WaterAid looks into it as part of our program and policy engagements, and now going forward, where are the opportunities? And since you people have and you are placed with some renowned organizations who are like working on, especially on the water issues. So I think as we move along, it's not a I am just presenting or sharing things, but you also are, as part your internship and as part of your environmental science background, you also have a range of information. So let's have a more interactive session rather than just having like I am speaking and sharing pointers. So I will be really more interested to have your opinions and perspectives that how you visualize these issues and how you understand these issues. Okay, so I think I would be having more reflections from all of you, and anytime you can raise your hand and you can come up with your opinions or reflections and all. That because I can see that you all have a very depth of information and depth of experience. Okay, so everyone agrees on this? Say some yes, no, okay.
Yes, ma'am.
Okay.
Yes,
So yeah,
ma'am.
so yes, so we will have a more interactive sessions. Okay, Anand, we can. So like water crisis in India, I think you all being students of environmental sciences, many of you, and being interning with some good organizations working on water, you must have understood this issue, like how acute water crisis is in India, and how the especially few pockets in India are like dealing with it. And when we see water crisis, we are talking water crisis in terms of quantity. When we see that everyone has an adequate amount of water to drink and use for their daily needs. And then we are also talking on the quality when we see the contamination part. And then we see on the sustainability part. So when we see water crisis in India, we look into all the three domains: quantity, quality, and sustainability. We can move to next slide, Anand.
Yeah, just before that, I would like
Yes,
to
Anand. Yeah.
you to imagine about this picture. Now you don't see water here, you see only a little bit of water coming through the well. So somebody has climbed down there just to ensure that this water can be put in that vessel and can be pulled up. Just imagine for a second that this is the water, only the water that they can drink in the whole day. So every time that this family will require water, somebody will have to climb down, somebody will have to pull up this rope, carry it over a distance, and ensure that water is available when required. It is not available from a tap, it is not available on a phone call, it is actually not there at all. And this well must be feeding at, or this water must be being used by at least say 40 or 50 households. And there lies the competition and the struggle that they have to engage with when they want to ensure a necessity of life, which is water.
Yeah. Yeah, just adding to it, like what Anand said, you to imagine, like I would just have you imagine one more situation, that you imagine your life one day morning waking up and having no water, like the kind of chaos we will land up in our everyday life in the morning, the kind of chaos we will land up in our houses. So we can understand very much the what the situation just Anand was talking about. Okay, these households which have only you can see the volume as well as you can see the how muddy this water is, but they have no option but to use this for cooking, drinking, bathing, and everything, whatever water use they have. So we can imagine putting ourselves into it and just imagine our houses without water for a day. Yeah, we can move to next slide. So we'll be talking about some water scenario here, and you must have gone through these statistics many a times. I think by now you have might have done lot of research as part of your internship. So you must have seen these statistics that how India faces high extreme water stress, and how the day by day depleting groundwater tables, and how like we have like we can associate this stress with the water trains now moving in the country. Like in some places in last year there were news that in Maharashtra the water train has to go and help people with this. So we can understand the extreme situation that India is into. And out of this, 75% of households do not have drinking water in premises. Like we may many times think that a stand post is there when we go in many times in urban areas also, or in rural area. You see that there are public stand posts where around 20 to 30 households, or many times more number of households, they can have water from there, and they have to wait in a long queue for an hour to have water. So a household having a household water tap makes lot of difference. So 75% of households still do not have a tap in their premises. The water related disease also, like is when people do not have safe access to water, there are lot of contamination is there in water. There are many chemical contamination, biological contamination leading to diarrhea and other infection, which amounts to lot of child mortality also. And then there are chemical contamination which is leading to numerous diseases. Like from arsenic we have numerous cases of arsenocosis, especially in this belt of Bihar, and there is these cases are very high. So there are a lot of disease related to if people do not have access to safe water. Water level is declining day by day. We understand it, and you can see the percentage here that how acute it is. And out of this is still like the kind of situation we are in, current situation, like the depleting water levels and the extreme water stress that we are facing. We have like estimates that 40% of population may not have access to drinking water by this 2030. So we can imagine, if given the India's population size and the population size of India, and then you imagine the 40% of population, if they don't have access to drinking water, how the situation would be. So, and this is leading to a lot of economic losses also. This entire water scenario is leading to loss in GDP also, because we associate is like the people, the time, the human time that goes into collection of water, and then so that is also we should take into account. And many times they cannot go out, like they have to stay in urban scenario. I will especially talk, like when you see in Delhi or other bigger cities, one of the family members have to stay in house to collect water from tanker when tanker comes in. So if that person can earn, or they have a job and they can earn money, they can have a better living, but they have no option, but they have to stay at home because they have to collect water from the tanker when tanker arrives in their slum. So we can see like the water quality index, India is at lowest level. It's not a surprise in this, and most of sources are contaminated. So we can see how serious the situation is. Any reflections on this? I can see chat box, Anubhav pasting like case study, and then there is Alka ji has details on that train, water train. So any quick reflections? Anybody want to add it here? Or should we go ahead? Okay. Next slide, Anand, we can move on. Challenges part. So I would like to understand some challenges from you all. Like you have been working on this issue and you understand this issue. So can you like one or two people, like you can share what key challenges you look into it. You can just raise your hand.
Yeah. In the meanwhile, can I ask this question that this Composite Water Management Index of 2018, is it a regular annual feature of assessment, or it is every 5 years? So what is the kind of frequency of this composite index is there? Is it global that I can understand?
Yeah. Anand, you would like to respond on this Composite Water Index? Like it is an annual or it is 5 year?
Because post-COVID, it's very interesting to see how the entire indexing is going to change, the ranking is going to change.
Just a second. I'll just. Can you see the presentation, or is it?
Is there on the screen? Is there on the screen?
Yeah. So it is on an annual basis that it is done based on the data that gets collected, and it can either be done. I mean, institutions can do it or countries can do it. What we are just quoting are figures that had been collected in 2018. So that's the way that and it is composed of different parameters in that sense. So in terms of water availability, scarcity, and other aspects. So if you want, we can talk in detail about it. That won't be an issue.
Yeah, so this 2018 report is like Niti Aayog has released this information. So this is, we can like update more on this. So,
yeah. Basically, I wanted to understand what kind of data sets available so that fellows also can refer to those authenticated, validated data sets.
So fellows can refer to Niti Aayog's report of 2018. Niti Aayog has published a report on this.
Thank you.
Yeah. So anyone
have question? Anyone, any reflection?
Hello. Hello.
Yeah.
Hello.
Yeah.
Hello.
Yeah.
May I submit something?
Yeah. Then Amrita. Yeah, please, Veena
Yeah.
ji.
Actually, you are talking about the composite index. Though I know Aanand and Shalini is there, and they all are referring to Niti Aayog. At the same time, simultaneously, this Secretary Water Resources, I'm listening Secretary Water Resources also simultaneously, and he is condemning the report of Niti Aayog, where they have given these many cities are going for the drought and all, and this year this is the just opposite of that report. And the Central Water Commission also have given that this is not on the factual data. So I think Central Water Commission has also come up with some index, but that is not now in the public domain. They are working to bring it to the public domain. So at this moment, we are only focusing on the Niti Aayog report. But there are other reports also, McKinsey report and other reports, SHM report also. So fellows may go through those reports also. That is my submission.
I think great. The point is that we need to look at different set of data and then look at the validation of part of it also. Thank you, Veena ji. Yeah. So yeah, anybody fellow has any question, any reflection, so that Shalini can move forward.
Yeah, we were just talking more on this challenges part. We can move to challenges slide, Anand.
Yeah.
So since India being the biggest consumer of groundwater extraction, we all know it includes agriculture water as well. It includes water for agriculture as well. So any other challenges, what like I would like to understand how you look these challenges at, how this situation is like. There are some statistics, and like statistics are always you can challenge them. There are multiple reports to cross validate, so there are always issues. But from your understanding, from your experiences, how you understand these challenges? Anyone who would like to speak? Okay, Alka ji have mentioned water quality.
Yeah. Shalini, if you see the rural perspective or the urban perspective, too much water and too little water is the big challenge. And along with this, the all associated problems are linked. Even if you talk about the water quality or the livelihood or the sanitation or the governance, so all are associated problem with too much water and too little water. That is a real challenge for India.
Yeah, thank you, Veena ji,
I
for
think the issue is
bringing
also that if you even have adequate water, the quality of water that you get is also a challenge. In addition to that, what you just mentioned.
Yeah, and then one of the points which Veena ji just mentioned is on the governance part. Like how this entire management, like here it comes the, I have heard like one of fellow mentioned the interest areas on the community participation. If I have understood it, there was a mention on that. So overall governance, how this entire this politics around this, I would have used much better word, but I would call it as a politics around water, how this entire operates with varied stakeholder. There is a household, there is a final recipient to get the water, but there are numerous stakeholders working around this entire water system, who control, who have their power relations, who have their own influences on this. So this entire governance system also has a very larger impact on this entire. Like if you have a large, if there is a gram panchayat, you can imagine they have abundance of water, then there are also issues of governance and management. And if you can imagine a village or Gram Panchayat with a very little water crisis, there are also issues of governance and management. So with the issues of adequacy, like the quantity of water, the quality of water, the sustainability part, every time depends upon the governance and the management practices that we have. So I would sum up it like this. Anand, you would like to add anything on this?
I'm fine. I think this is we also have data and other things to show. We'll just go ahead.
Yeah. So there are like other challenges also, which are statistics oriented, and they have reference from some like Niti Aayog report, and as Veena ji has mentioned, there references of other reports also. So we can go through them also, but these are few statistics which mention that Central Groundwater Board, according to Central Groundwater Board, contribution of groundwater in irrigation, rural water supply and urban water supply, they have given ranges like it is irrigation has around 62%, then rural water supply 85%, and then the urban water supply comes to 45%. So this is on the how groundwater contributes. Then there are statistics on the demand and supply gap, and by you can see the comparison between 2008 and then 2030, that how the demand and supply gap is its range is increasing. So we can this statistics give us like how the water stress is increasing. There are depleting water table. There are like surface. There is no surface water available. Rivers, ponds, lakes, they are drying up. And then as the population is also increasing, so demand is also increasing. So we can see that how that entire this issue is getting more fierce day by day.
So if you see on the right up on the left side, which is in blue box, the contribution of groundwater in irrigation, rural water supply, and urban water supply is approximately 62%, 85%, and 45%. This actually tells you the sort of groundwater dependency that different communities, if you can segregate them like this, have. So in rural conditions, about 85% of water comes from groundwater irrigation, and therefore the depth of the water keeps on increasing. In urban, it's 45% because you get sources and you get water extracted from the rural populations and locations and ship it to urban locations. And this demand supply, whether you measure it in Indian reports or reports that come from consultancies or others, all show that this is going to increase and will continuously cause stress as we go ahead. Now, obviously, the disadvantaged and the poor population who are not able to fight for their rights or even articulate enough or have time enough to talk about them will get more and more disadvantaged as we go ahead. On the right hand side, you see the difference between 2008 data and 2030 data, where the demand is going to outstrip supply by a huge amount, by nearly 200% in that sense, and therefore we need to actually ensure and work towards ensuring that such water is available, is equitable, and is accessible by the poorer and the most disadvantaged. Shalini, would like to take up from here?
Yeah, you want to? Yeah, please go ahead, Anand.
If you see in the groundwater, and I remember that, and I see that a lot of you had mentioned, groundwater extraction, water harvesting, climate change. I think all of these impact the sort of availability of groundwater and which are the ways that it gets recharged. So if you can see on the right, the key to this pie chart, the recharge is from rainfall in the monsoon season, and then you have a recharge from which is the maximum thing that happens in India, which also comes in through snow. It comes through river water. It comes from surface water. Surface water being solid, the ponds and lakes which get full with water when the rains come. Then you have recharge from other sources during the monsoon season, which basically is also, the part that is there, and from rainfall in the non-monsoon season that comes up, and then finally recharge from other sources in the non-monsoon season that is there. So if you see, the maximum sort of recharge that happens in India is only in the monsoon season, and then based on that, if it can be collected, if it can be coordinated well within different agencies, so your rivers, and ensure that the catchment is there, and that water can be trapped and stored for usage during the period. Other sources means extraction from groundwater, and also like you have snow and you have other aspects which also get captured and then can be used, but obviously in much more limited quantities. This is a challenge that we face in groundwater quantity, and therefore in locations where you have higher needs, like in cities or in locations where the general population is much more economically in an advantageous situation, you have higher extraction of groundwater which are non-rainfall based, and that actually puts a lot of pressure in ensuring water availability and ensuring its continuation. We have a lot of cases in which groundwater is extracted to 500 feet. Earlier it used to be 20. If you still go to a lot of rural locations, you'll find water at 20 feet or 30 feet or 50 feet. But there are places in India where you have dug up till 1500 feet and you still don't find water, because the entire aquifer that is the charging where water is stored has already been extracted either for industrial applications or because there is no charge or no taxes that are imposed in groundwater. If you see, groundwater basically is available to all, and the person who has the most resources is able to extract the maximum amount of it in that sense. Talking about the status of quality, a lot of adulterants, if I can put it in that sense, which are not only from industrial applications, if you have in those locations or you reside in those locations, but you also find that the aquifers that are there, the sort of usage of material in agriculture, where you find nitrates being used in fertilizers, fluoride being available because of leaching and other such aspects, trace metals, pesticides, and radioactive elements, which are carcinogens, and the more of them that you use, the more it will be difficult to sustain and enhance livelihoods in these locations. So we have found these in huge quantities. It's not that rivers are empty of this. You have a lot of untreated dumping in the rivers, including Ganga and others. And there you find that because of this, the water is even not fit for drinking in a lot of locations. There's a lot of work that the government is trying to do, but it is not only up to the government to actually ensure that this sort of water is available to everyone, that ensure that they remain healthy. It is also upon us, upon the organization that we work in, upon the industries that we work in or lead or be a part of, that they also treat water before, and other sort of activities that ensure that water that they use is treated well before it is either recharged or it's allowed to flow in drains and then in rivers. Talking ahead, the recommendation that we want to do across the work that we're doing, and this we have been doing for the past several decades now. We assess water quality labs. We have district level labs in all the districts across India, but a lot of them do not have personnel, they don't have facilities, and they lack in terms of the practices that they follow. So our role is to assess and bring this data in the open so that the governments take note of it and then try to provide them with facilities so that water quality tests can be done, and that can create awareness and ensure availability of good quality water. And this also includes testing and treatment plants where we assess the quality of water that comes out, and then what are the facilities available, if the filter mediums and other such aspects have been changed, or are they just lying for waiting for aid to come in from the government, which also takes time and which is also not a priority for a lot of state governments. Decentralized water quality monitoring. Is it necessary to only test water when the lab tests are happened at the district level, or should it be done by the people who feel that the water is tasting like this, so it's not good, or they are finding disabilities emerging because of usage of the water that they have in their ground? So how do you decentralize? We use it by giving quality kits, which the communities test for themselves. This actually acts as an empowerment tool more than as a data awareness tool, because the community starts to understand and become aware of challenges that they face. So field testing kits are deployed for getting total water quality monitoring, for informing local leadership, for engaging with local volunteers like the Jalabandhu that we have, which are unpaid volunteers who work to increase awareness on fluoride and ensure that whichever water source, whether it's a tube well, whether it's a dug well or other water sources, are actually which of them are fluoride free so that the communities can take that water. We work to develop water security plans. So if you look at security, what it is actually, it is income security. Now, how do you ensure income security? You can ensure income security when you ensure food security, when you ensure water security. In a sense, making security available to all the communities, to the households, so that they can have better and more enriching lives. So one of the critical components in this, and which has also been recognized by the Jal Jeevan Mission, is that you need to plan for water security, which basically means you have to take an assessment of what is the water that the village or the particular habitation is getting and how is it being used, and if there can be better ways of managing of this natural resource. So based on the water security plan, making a village action plan for the entire village, where they all come together to ensure that the supply and the governance, and ensuring that poorest of them living in remote and secluded locations are also available. This is some planning that the communities have to come together and do. And the government has made enough notification in this regard. Integration of water recharging, source sustainability, ensuring that if there are wells, they have water, in ensuring that if there are pipelines laid, they get water. And how do you ensure this? You do this by ensuring that the source from which water comes actually gets clean water as a recharge and is tapped in an economical manner to ensure continuous availability of water over the year, especially in water scarce months, and ensuring quality is maintained in rainfall, in seasons when there is rainfall, because then the water quantities rise, but the quality goes down. Making and repairing roof or normal rainwater harvesting structures across all the projects. We have done this across several districts. We work in around 50 districts in around 13 states, and we have our lessons which we share with the local governments to ensure that they feel proud of it, that this is being done in their location, and then they get inspired to use the money that is already available with them to scale up the efforts that we are trying to seed in that sense. What we also do is that we pilot new innovations, new initiatives for wider applications. So a couple of these things, and I wouldn't say these are only a couple of them that I mentioned here. We do a lot more than this. We try to ensure that, you see, what is happening nowadays is that the tube wells, wherever you sink in, the dug wells are getting without water, because the tube well decreases the level of water and dug wells go dry. So how can we use these dug wells to ensure or recharge or demonstrate local water conservation by ensuring that clean water is allowed to go in them, and then they can recharge the low-lying aquifers, and then tomorrow the wider community can extract that water in the wells, in the hand pumps, and also and not at the deeper. So if you see a tube well, it goes for a deeper aquifer level, which the poorer community cannot access, and they generally look for shallow aquifers. So ensuring dug well recharge will charge up the shallow aquifers to ensure water is available and is accessible to the poorer communities. The second thing that we are trying to do is to, so in a watershed, what happens, I don't know if you have an idea about that, but in a watershed, you just collect water on the surface, but that does not ensure that water is available to in the location, because the recharge might be happening in some other location, and the exit and the water usage might be in some other location. So how can you ensure that managed aquifer recharge happens and then communities engage, so that the recharge for that water in any location will actually feed the community in another location? Given an example, if you see the water that gets collected in Banaras, it actually is getting recharged from Salimpur Kheri, if I'm getting the name right. It's on the border of Nepal. So water getting recharged. Lakhimpur Kheri. So Lakhimpur Kheri, the water gets recharged there. Actually, is water is harvested in Varanasi. In a sense, we need to understand these geographical limitations and flow rates and recharge mechanisms to actually ensure what is available. It's not that if you recharge water or if you trap water or you store water, it is going to recharge the same aquifer. It can shift. There's a lot of aspects around this. If you see the same thing in Patna or locations nearby, there are aquifers at 3 levels. Now, which aquifer a person can trap or get water from differs in sense of the economic power that he has. Also, what needs to be recharged. So you can't have a recharge at the deeper aquifer and expect that the shallow aquifer will give you water. So getting these understand is something that we're trying to do in the next 3 years across 18 locations. We are trying to work with the communities to understand where does recharge happen and where do they need to tap water, and seeing a combination between these two. We are working with one of the best organizations in India called Aquadam, which are niche into this technical sort of work, and we're trying to implement it in terms of, so you see the technology is already there in existence and has been there in existence for several years. It's never about the technology. It's how you implement the technology, how do you ensure people own up the technology, and how do they then take it up to make it a part of their lives. So having a technology is a good thing, but there are hundreds of technologies across India that you find abandoned because the communities don't find a relationship with them. Once you build that relationship with the community and the technology, then they own it up. Because in any project, even in the government, will only prioritize a technology over a period of time. So for a government, it's 5 years. For us, it's a project. It can be for a year or 2 years. Within that period of time, you have to build the technology to become a part of their lives. They have to own it. They have to buy in. They have to feel that it is about them. It's not about what we are pushing or what the government is trying to push as a part of their priority. It is a priority that the community has to own. And once they do, they don't require us. They will continue to use the technology for the future as they go ahead in their lives. In terms of policy recommendation, where we try to influence the state government, the central governments, we try to work with them. As a policy, we don't engage in projects directly funded by them, because then the voice that you have with the government is looked at a different manner. But what we definitely want to do is to help and aid them to ensure that they maintain their own mandates, they work with communities, and their work becomes easier and scales up. So in water quality, we've been working with the communities and sharing the data with the state public health engineering departments, also working to ensure that the labs work well and that the water quality that is supplied through pipelines meets the water quality standards and actually maintains them. So that if you ensure that decentralized testing of water quality happens, then we don't need to tell the community. The community by itself tests the water and finds that if it is not maintaining standards, they start having a discussion with the PhD and other government department. Because it's for us, it is a project, or for all of us on this call, it will be a project at the maximum. For them, it's their life. So they definitely want that them and their future generation have better water, and then they start advocating and they start reaching out to the government arms and asking that they should be given better water quality. Also activating district and subdivision labs to ensure that they function and they give out tests as required. Streamlining water quality monitoring and surveillance, and ensuring that wherever there is a gap in what quality is there and any remedial measures that can be taken, ensuring that it happens and is done well. So there's sustainable mitigation of water. Lastly, for water governance, development of water policy at state level, helping develop guidelines, finding out gaps, pointing it out to the local government so that they take note and they take notice as they go on, and then facilitating a convergent platform for dialogues with different stakeholders. Because in water, if you see, there are different departments holding different. So health would be with women and child development. Supply would be with a different department. Quality will be with a different department. Getting them all to collectively monitor and complement each other is something that we want to do and we are trying to do. Lastly, talking about the Jal Jeevan mission, this is a new mission that you must have heard our Prime Minister talk about, ensuring from a spread of 18% coverage in India to reach to 100% within a period of 5 years is an extreme ambition. He has called upon everyone to support it, and there is a huge amount of money that he's allocated for it, about I think 3.3 lakh crores that is there. How do we ensure that water is available to all the households, functional tap water household connection, and each person rather is getting 55 liters per day for their needs, for their cooking needs, for their other household purposes. It is a huge challenge, not only in terms because it is not going to be something like the Swachh Bharat mission. Here you have to ensure continued water availability of the right quality and of the right quantity. So we are involved in this. We have been part of this, and we try to support the government wherever we are working across different districts. In this, there was a Jal Shakti Abhiyan in which our state, within Gaya, which is a district in Bihar, our work had found mention. We were topping till the last mile, and then we came sixth across India in that. There's a vision that is attached to it, ensuring drinking water supply to the rural communities on a long-term basis, so that it improves the living standards and the health. And the goals that is within that: assured water supply functionality on a long-term basis, ensuring that operation and maintenance in terms of technology are being taken care of by the Gram Panchayat, its subcommittee, and the community over there. And lastly, opening water testing facilities to the general public so that they become a part of the process rather than just the recipients of work done by the government at different levels. This is a sort of work, just a slice of the work in a short period of 1 hour, which I think I've already passed. We are trying to share. As your interest and as per your questions, we will answer. If you want to have a longer sort of reach or probably working together, we could be looking at that if and when opportunities arise. I'll just end here. I think I'll just end with a picture that is there. So you see this girl who's trying to get water on a daily basis, and women are generally tasked with this. They have to go 2 times, 3 times in a day, whether it's rain, sunshine, or snow, whatever the issue is there, to fetch water for the families, and then to carry it. This creates a lot of health issues also. But this is something that is only for women to do in this. In India, where patriarchy is more prevalent in that sense, and she has to go in the deep to get better quality water, and not from the side where you'd have much more muddy water. But this is a fact that every one of them face on a continuous day by day and within a day basis. Our role and our mission is to try to solve them wherever we can, with their help, with their support, and ensure that they own the process and take it forward continuously. I'll just end here. This is the one that we are trying to do, and we are open for questions or anything that you'd like to ask us.
Thank you, Aanand. I think I'm amazed at how you really compiled everything in 18 slides. And moreover, half of the slides were talking about challenges at great length. But yeah, this is amazing the way you have consolidated your strategies and solutions. Here, I have this 3 questions that I have posted to start the discussion, and then yeah, fellows can ask by unmuting their mics. So, Aanand, if you can read, or you want me to say it, then I'll say that.
Yeah, if you can read it, will be good, because I'm somehow not able to see the notes. Yeah.
Not a problem. So the first question that I'm asking is that in this slide where you were showing the solution, that you were talking about the labs and the assessment. So I wanted to understand, or I wanted fellows to also understand deeply, that is it independently that WaterAid does, or is it does for the government, and how you disseminate your result? That's question number 1. Then I'll come to question number 2.
Please go ahead and tell all the questions. We'll give you answer all of them.
Great. No problem. Second question that I'm asking is that you talked about these strategies and the approach that WaterAid has to address the challenges shown there. But while implementing the projects on ground, what kind of challenges you're facing? Because that's also very important part of learning for the fellows. And the third question that I have is, how do you implement these projects? You go directly in the field, you have your field staff, or you work through your partners? Who are their partners, your partners, if it's through a partners network that you do?
So I'll answer your last question first.
Okay.
In the sense, because I think that's central to what you're asking for the 3 questions. The way that we work on the field is that we want to bring change. We are not in this business to talk about change. We are not in this business to show change in the sense of document it. We are in this business to actually bring about change in communities who have been left out because they are either too poor, or they are too remote, or they don't have the means or the wherewithal to actually approach the government because of several factors that they might be facing in terms of natural issues or in terms of man-made issues that they might be there. So when we work on the field, the way that we approach the work is that we get projects or we ask for projects, and sometimes the interest comes from the donors. Sometimes we want to work in a particular location and we want to ask donors to focus on that location because of the problems that the community faces. The first way that we have done it is we've identified locations in the core districts that we have in these core states, where we actually have found that water related aspects, whether it's quality, quantity, availability, access, even climate issues that might flooding and others. So we've identified few locations where this has been an issue. And we're trying to work in these difficult geographies where you will generally not find donors interested or even willing to consider, because donors also, in a sense, are looking for easy returns or easy rewards on what amount of money they give. But we have, touchwood, have been able to convince them and make them as a part of a journey. So the ownership not only starts at the community level, it starts at the donor level. And then with communities, we work with the local partners. Now, there's a strategy behind that. We don't work directly because we feel that we are more technically advanced in that respect. And it is our duty and our role to ensure that the local partners, local NGOs on the field receive that much of training and support so that they become independent and confident of being able to promote these as part of their own projects and with their own local circle of donors. Because these such organizations will remain in these locations for the next 20, 30 years. And our role is to ensure that within the project cycle that we have, whether it's 1 year or 3 years or 5 years, we train them and build their capacities. And then from there on, they can own this entire process and make it up as a part of their current portfolio of activities, whether it's livelihood, whether it's AIDS, whether it's health or whatever they want to do. So what has happened is that when we have worked in this manner, you suddenly find that they have started writing proposals, they have started getting funds for this, and the moment the funds, the projects close, we leave those locations, and the community still continue to access this sort of service from these NGOs because the NGOs have become confident about it. Recently, one of our partners bid for a project who had never earlier done this in Palakkad, and they got a project from the government to rectify or improve 800 wells. Now, this was never possible because they suddenly became confident over a period of 2.5 years, and they wanted to go ahead and strike it on their own. And we were very happy when they got this tender, which they had not even imagined possible a couple of years earlier. Similarly, in all locations we do that. We leave behind an enabled organization who understands WASH and who can promote this with their own circles in that sense. So that's the way that we work. In terms of the labs that you talked about, the mandate that the government has is that they will have a lab in all the locations, in all the districts, or even blocks, which will collect the data and will provide the quality, water quality as a service to the community. This is the mandate that they carry. The reality is very different. You will find labs which don't have regents, don't have equipments, don't have people. The door is either falling off or the roof is either not been taken care of. But once you re-energize the entire community to start asking this, and when you point out that these are the flaws that are there, it becomes imperative that they start looking at it from a very different point of view. And we tell them, like in Bihar we have done, in MP we have done, we bring this as a study for say 20 or 30 labs, and then the government sits up and takes notice that okay. So for them it becomes an easier activity because somebody has done this. But if their own employees do this, then the sort of importance that is attached is, I think, probably not that much attended to. So because of this, working with PhD, Public Health and Engineering Department, we have been able to ensure that they give more attention to this. And for them also, it becomes a support that they have been trying to gain over the period of time and try to solve their own issues. So working together, trying to bring aspects such as communities into it is important because in the end, it is meant for the community. And our role is to just energize the communities, to empower them, to make them aware of challenges that they face, and then to talk and ensure that the government is not forced to take an action, but becomes aware and actually wants to take an action. Because if you see the governments, it is not that they don't want to work. There is so much of challenge that they face, understaffing, less amount of money coming in, the rate at which money comes in, to support the work, that they are overburdened. They just need some amount of support to do the work that they actually want to do. So our role is just to facilitate the process, bring stakeholders together, and then ensure that they all work together in the future, uh, understanding and appreciating each other's strengths and weaknesses. So in that sense, we try to work with the communities, with the labs. I think I missed the second question that you probably had shared.
It's fine. I think let's just take questions from the fellows, and if we have time, I'll come back to that question. So because they're posted in the chat, and I'll just ask them to speak also. So here, Anubhav has a question. So Anubhav, if you can just unmute yourself
Take the
and
question?
ask.
Chai, can you take the question?
Yeah, I will.
Yeah, Anubhav.
Yes, ma'am. Should I speak?
Yeah, please.
Yeah, my first question is about the groundwater recharge you were talking about. That with increasing concretization, how we can ensure the groundwater recharge as urbanization is expanding and is taking place at faster rate. How groundwater table can be recharged?
Okay, Anubhav, yeah, sure. You want to go through all the questions? But as I have read your questions in chat box.
Yes, ma'am. I should ask all three questions at a time?
Yes, you can read it. I have read your questions also. So you
Yes, ma'am.
can.
My second question is about arsenic pollution. As what I have read it, it is more of natural thing. Then how can minimize that pollution, especially in the Bihar and Eastern UP region or Bengal region? And the third is during COVID time, people tend to afraid of going to the community well and ponds, and we are most of the time looking towards conserving ponds and uh, digging wells. Then how the people will be convinced to use that during COVID time?
Okay.
These were three questions of mine.
Okay, thank you, Anba. So I'll go through all the three. So see, yeah, you have very rightly mentioned that how this groundwater recharge will go with this increasing urbanization and concretization. So there are see options. With the rural area strategies would be different, and for urban area strategies would be different. So in rural areas, groundwater recharge, like as Anand was mentioned in his presentation, that how we should work on recharge through like these dug wells and all, with coming off hand pumps and other stand posts and all the old wells and all which were there in villages. They have gone like abundant now. People are no longer using it. So recharging these dug wells would help us to do in the rural areas in more systematic way, this rainwater through rainwater harvesting. So there are other numerous methods to do it. So it depends upon area to area. Like in urban, you can go for roof rainwater harvesting. Like lot of resident welfare associations in urban areas are now encouraged to do this. It has become mandatory as part of building bylaws also. Lot of buildings, their maps and all architecture is being passed only when they have these design inbuilt in their this design part. So there are ways of doing it. In urban also, there are lot of talks on revival of water bodies, especially in Delhi. Like Delhi government has taken lot of initiatives. There are traditional water bodies, and they are having schemes on revival of this. So it will differ from the context in which you have to focus on. Okay. And then moving to your arsenic, yeah, you rightly mentioned it's more of natural. And see, many things are natural, but when human interventions many times aggravate this problem. Arsenic is there in Ganga belt as a natural chemical. It is there, but the deep drilling, when we go deep borewell drilling, the deep borewell drilling has this made this issue a more acute. It has impact has enhanced to a larger scale, because with the deep borewell and the arsenic already present there in a natural form, And when you do deep bore well, there are there are scientific explanations to it that oxygen goes there, they have a reaction, and then it becomes dangerous for human consumption. So, like through our human intervention, how we aggravate the natural existence, like if a chemical is naturally present, so through our human practices we have aggravated it. So for that, the main options are solutions are there. The water should be made available through surface water. So that is why there is more emphasis laid on providing drinking water, especially through surface water sources. And coming to your last questions, yeah, during this COVID time, there have been lot of issues, like because especially in urban areas where the in slums where you have a very close packed houses and there are one stand post or two stand posts and people gather there. If tanker come, people gather there. So how to I will tell from our WaterAid experience, we launched a 8 days campaign across all the districts where we work, and it was a social media campaign and it is very well launched so that message could reach down to the community level through WhatsApps and other social media, and we had our community leaders lined up for that. And then we made aware people like community that how to use your water points at this time of COVID, how to maintain physical distancing at this time, how to, like if one person has used hand pump or a tap right now, how the cleaning should be done. So in our projects we have our operation and maintenance committees, like Anand was talking about operation and maintenance. So we have operations and maintenance committees who have played a very important role in increasing this community awareness and having some standard set rules in the community, and the community followed these rules, that how maintaining all precautions they can have access to these water points. So I think, Anubhav, I was able to answer your questions.
Yes, ma'am. Thank you so much for the detailed explanation.
Hello. Hello.
Yeah.
Hello, Alka.
Yeah, Vinaji.
I think Shalini has mentioned all these things. I don't know. Actually, when we talk about the urbanization and concretization, what this fellow have asked, Anubhav, one thing is for the rural, Shalini have mentioned about the dug wells and everything. But as far as the urban is in the context, I think rainwater harvesting is the very good solution for the recharging.
Yeah.
And I think that was just missed. And about the arsenic, she's rightly mentioned that it is already in the Ganges belt. And what I want to supplement, that it is geogenic, basically. It is geogenic, and as soon as we are going for the deep drilling for underground water, we are actually damaging the aquifers where it is stored arsenic. So the second question is how community can be benefited by the kind of good water, and what kind of solutions are available. So one thing is that Jal Shakti department, our ministries already working for providing the tap water, as already pointed out by Aanand and Shalini. But at the same time, lot of NGOs are already working for the marginalized community for providing the safe drinking water, and basically in context of arsenic mitigation. And they have the low cost sand filters. There are many organizations who are working on this, and I think all the fellows have listened the our one of the speaker from Segal Foundation, and they have provided the community solution for this. There are Dhan Foundation who is also working. So just I wanted to submit this.
Thank you, Veena ji, for your inputs. I think we will also park this question of, recharging in the urban locations to next week when we have CSC also coming, so that we also get their perspective. And we move forward to Shweta. Shweta, you can ask your question. Can you please unmute yourself and ask your question?
And explain it also, like how you are looking this income sources. What do you mean by it?
Yes, ma'am. Sure. So, ma'am, we know that WaterAid has been working tremendously when it is coming to provide safe access to water and decent toilets and sanitation facilities. Like while developing case study, I came across one of the intervention where the capacity buildings of the volunteers have been done so that they could manage the normal maintenance by themselves only, and also they are able to generate some source of earning from that. So my question is, in this context only, that within when we are able to provide them the access to safe water, would we be able to we be able to provide them the earning source also?
Okay, and before Shalini and Aanand takes it up, because we also almost at time we're going to close. So any other question that is there, can you raise hand? Anybody has any question, so we know how much time we have in hand. Because Aanand also has to leave in by 5:30 max. Yeah, Shalini, you can give a quick response and type rest of it in the chat. Yeah.
Yes. I would respond to Shweta, and if I would request Anand also to add on this.
Shalini, I'm really sorry. One sec. Can we just get up? Because before Anand leave, I would like to have a photo opportunity. Now we can only have through this one. If everybody can switch on their camera, and we can continue for another 5-10 minutes later also. But everybody, all fellows and all, can switch on their cameras, and we can have a picture for our, documentation. A very quick one, so that let's not invest time on that. Yeah. Yes, Shweta, Lipi, Syami, Upma. Okay, Aanand, you are also need to switch on the camera.
Okay, sure.
Yeah, one shot we need. Great. Yeah. Yeah. Sanjay, we got it. Shweta, you move a bit far off. Yeah. Great. I think wonderful. Thank you. This is how we now click pictures. Can't help it. So thank you. Yeah, please continue, Shalini and Aanand, with the question. Aanand, you can leave, and thank you very much for all the input and making it really concise presentation. I think putting it all together in this 18 slide was a challenge, and you have done it pretty well. And anybody has any questions, please, you can revert to them. You can post it to us.
Hello.
We will ask. Yeah. So here, thank you, Aanand, because Aanand is leaving in another 4 minutes. Yeah. So Shalini, we can and Aanand, we can continue with the response in the meanwhile. Shalini, we were talking about the Shweta's question.
I will just quickly respond to Shweta's question. When we talk on access to drinking water, so operation and maintenance is like a key component of it. And I will give some example where we have attempted to bring it that income generation aspect to it, where like as part of operation and maintenance, we have trained a lot of plumbers, and so that they can within their area in their village they can provide that service of operation and maintenance of water sources. And I will take example from Mahoba, where we piloted this, and where we trained these plumbers, and their list of these plumbers was provided to district administration, that these are the plumbers which are available. They are trained to do the operation and maintenance of water source, and if there is any breakdown, they are available. Because in rural areas, if a water source there is a breakdown, then it takes a very long time for that source to get like repair, and if some like mechanic has to come from block or district. So if the local resource is there, a local trained person is there to do that repair and maintenance, so the water source get quickly repaired and people start using it again. So the breakdown and the repair of that breakdown and this time lapse is also very important. So if the water source which is feeding to 40 or 50 households, it breaks down, then for next 1 week they may have no option. So and they may have to travel long to get. So to break this cycle, we trained these people and we provided the list to district administration that these trained people are available. So they will not only work in their village, but in neighboring village. If any gram panchayat calls them for the services, so they will pay them also. So there are ideas, there are options of bringing and wash entrepreneurs and providing that income generation aspect also. But we have like tried it and piloted in some locations, not at a very large like across all projects, but we have examples where it has worked well, especially in ashram shala thing. Anand, I would request you to add like how the village youths have been trained and they are doing that operation maintenance.
So what I'll just about ashram shala, but it's not always that money is a criteria. Sometimes volunteers want to work in their communities, and they are already doing some work. So this adds to their work, and they are very happy. We have Jalabandhus in Noapada in Odisha who are doing it free of cost for themselves, but they want to be involved in this. So while in cities we look at money being a criteria, in rural spaces that is not always true. Talking about this model that we have tried, social service provider model in ashram shalas, we tried out local ITI students who complete the ITI or the polytechnic. Not all of them want to go to cities, because in cities you'll earn not much, but the expenses are quite high, and so a lot of them stay back in their own communities doing farming and other such shopkeeping and other such aspects. The issue was that how do we tap into this existing people trained technically and not having a vocation like this. So we found them out, we trained 4 of them as a model, and we worked with residential schools where their role was to go and repair whatever facilities in wash was not available. If they required something more than just a repair or a tightening, the list was shared with the headmaster who then provided these. And so they actually helped ensure that the wash facilities, toilets, pipelines, taps, tiles in that, and then also after that electricity related were functioning well. Now in remote residential schools like ashram shalas, where the population of about 500 children are there per school, they don't generally get anybody to come to that location to work. So it was in a sense a win-win for the trained people, the ITI passed students. It was a win-win for the ashram shalas who did not get any of these to come to these remote locations, and it was a win-win for us in a sense because we got all of these to address their needs in that sense, and therefore it turned out very well. Over a period of I think 8 months, they did a lot of repair and the facilities were working in these ashram shalas, and it actually helped ensure that these facilities were available to the students for their own use. So this is the sort of work that we are trying to do, trying to generate employment, whether it is entirely through wash related activities or partly through that, and also trying to use local manpower to ensure that such facilities are mended by them, and therefore the sense of ownership, because it's just a work, and that ensures that people can access them and easily work on them. So in a sense, we're just trying to address those challenges in Jal Jeevan Mission, because this will involve about 6 lakh villages. The interest that WaterAid has is to how do we train or have manpower available in all these locations. And by manpower, I don't mean women power also. So we have trained teams of women who go about maintaining hand pumps available locally, so that they can go and repair and ensure facilities for their own communities there. It's also, I'd like to just point is that we not only, so WaterAid is just one of the several organizations working. It can be ActionAid, it can be, you name it, CARE, it can be any other organization. We are happy the more organizations come in this space because there are very few. And therefore, we also are training partners so that they also become, they also take this up as they go ahead. So I'll just end here. I think, I hope I've answered the question.
Yeah, Anand. Yeah, Anand, yes, I think, yeah, you answered it pretty well. And I think it's a time now we need to, I think, let's wrap up the session. Students also has to leave and you also has to leave. So, and Ajay has a remark about his observation, Shalini, that you can see in the chat box and type in the chat box itself. And so with these words, I think, Veena-ji, you need to add something because let's wrap it up. And
I would
Anand
just
and
like to
Shalini,
respond in one line to Ajay. Yeah, that water is a community resource, but in India, that perspective of treating water as a community resource has not come. What we see, the water below my house, the groundwater is my water, because government has not made any stringent rule to manage water as a community resource. So that community participation that I was saying has not come in. So that is what, like, water below my house is my water. So we treat it like that. So how the way, like, I can take volume of water, I feel like.
Yeah, I think that's very well said. Shalini, any reference report publication that's available in public domain from WaterAid side that if you can mail it to us links, we will share with all the fellows that will give.
Like they can visit our website also. Lot of resources there on WaterAid India's website. Lot of study reports are there also. So a few of, I will share link as well.
Yeah, thank you very much. I think what I liked, I think I would like to quote what Aanand was saying, that technology is not an issue. I think what is the issue is that how do you really implement it and have ownership of that and also make that as part of the life. I think this is what we are talking about. The solution is always not technology, but how you really take it forward and scale it up along with it. So, Veena-ji, if you want to add any last minute words, then I'll close the session.
Yeah, thank you, Alka, and thank you, Shalini, and thanks to all fellows. I think today's deliberation was very, very exciting because Shalini started with the note and Aanand also with the note that it should be participatory. And I think rather than giving a only presentation, it was a very, very good experience to interact more and have a good interaction with the fellows and their queries, and to understand their situations where they want to clarify or demystify the solutions. And I think Shalini and Aanand both have interacted in a very, very efficient manner to provide the all kind of organizational knowledge as well as the experiences and expertise. And not only the WaterAid what they are doing, but apart from that, what are the probabilities and what kind of new challenges are coming and how these challenges can be taken up by the fellows through the career. I think it's a very, very good deliberations, and I thanks all of you, Aanand, Shalini, and the fellows who took a lot of interest, who had asked a lot many questions, interacted, and they are continuously interacting with their organizations, and whatever they are learning, they are asking also. And I think this is a kind of interaction which we required through this program. So thank you so much to everyone.
Thank you, Veena-ji. Thank you very much. Aanand, any last minute, Shalini and Aanand, you want to say any last minute few word in closing remarks?
I just have only one advice, and it is up to the fellows to take it or not. As you go ahead in your careers, the only thing that will separate you from somebody who just speaks about it is the field experience that you will carry. So wherever you go, whatever you do, the initial 2 or 4 is that you will struggle with, and I'm not saying telling that you will solve issues and questions, but the initial 3 or 4 or 5 years that you spend on the field in whatever line that you go ahead will be what will sustain you for the next 30 or 40 years. So just take it from somebody who has also been through the same grind, and I hope all success in you in your careers and your lives ahead. Thank you.
Great, thank you. Shalini?
Yeah, thank you. And it has been a great interaction. And I would just like to mention that although it is a profession for us and we work as professionals and look at it as a career, but I would always insist that we should feel that for whom we are working, we should always keep the last mile person in our mind, like with for whom we are working. So that passion and empathy, I would say that being a profession, we are working. I am also doing a job with WaterAid, but as a person, I also feel the commitment towards the cause or the person, like the photograph which Aanand shared at the start of the presentation, like those should always be in our mind that it is where our efforts are targeted.
Thank you, Shalini and Anand. I think important part is passion is the driving force for all of us, and that should continue and pass on to the fellows. And thank you, fellows, for joining and making it so lively and wonderful. And looking forward next week with CSC. Thank you very much, everybody.
Thank you, everyone. Thank you.